enter the room.
Hello, examiner GMC number 7960372. My name is Mohammed Ibrahim. Good morning.
Good morning.
My name is Ibrahim. I'm one of the FY2 doctors working here in injury surgery. I'm really glad to meet you.
Hi.
I'd like to check a few details first. Can I have your full name and age, please?
I'm Tom Riddle, and I'm 57.
Okay, and may I call you Tom?
That's all right.
Brilliant. And I can see from my notes, Tom, that you have been diagnosed with a condition called ALS, which is amyotrophic lateral sclerosis. Is that right?
Yes, that's right.
Okay, great. And can you tell me more about that, about your condition? How much do you know about it?
Well, it's been about 8 months since I've been diagnosed, and yeah, I know it's something that will get worse. I've been told about that, and right now I've kind of made my peace with it. So yeah, that's exactly what I've come to talk to you about, doctor. I've heard of this new medication called Riluzole, I think, and I've heard that it could cure this condition, and I would love to know if I could be, eligible for it.
I see. First of all, I'm really sorry that you've been diagnosed with this condition, and you mentioned a lot of like you're doing your best to cope up with that. So I really would encourage you to keep doing that as much as possible. And if you think there is something we can do anyway for you at any point, always call us back. The other important thing you mentioned about the medication. So, and you mentioned whether it's related to a cure of this ALS. So we'll have a discussion about that. But let me just a few questions to make sure you're okay. Is that all right?
Yeah, sure.
Okay. So, in terms of symptoms of ALS, how much you have at the moment?
Well, currently I have some muscle cramps, some twitching, and I do have these weakness, especially on my hands and feet. But it's manageable. We're managing with it.
I'm really glad you do so. And do you have any difficulty in walking at all?
Not yet, doctor. I know this is something that is going to set in. I've been told about it, but yeah,
I see. And what about feeding and eating? Is everything okay?
no, everything's fine.
Okay. And have you not, how's your mood since 8 months and you've been diagnosed and you mentioned you're doing best? Is your mood still okay? Like, or there is something bothering you with that?
Well, yeah, well, when I first heard about it, it was difficult, but yeah, we are doing our best with what we know, and we're trying to learn more about it, and that's exactly how I came across this this medication, and I mean that's something that brought us hope. So yeah, I definitely want to see if I could use it.
Yes, I can see how much you are keen to talk about this medication. I will do that as soon as possible, but I just want to make sure I can cover every aspect and make sure you're safe before we discuss that. Do you follow a healthy lifestyle, like good diet, for example?
Yes, doctor. I mean, yeah, my wife makes me eat healthy.
That's
Make
great.
sure.
That's great. And do you smoke?
No, doctor.
Do you drink alcohol?
I mean, I'm just a social drinker. I mean, it's not a recurring thing.
Okay. And do you move around as much as you can?
I try to, but my exercising has been a little limited, especially since I've been having this weakness.
I see. It might be a bit difficult, but I still encourage you to do so because it's one of the things that help your health. And have you been in contact with physiotherapists so far?
Yes, I do go for physio.
Okay, and the occupational therapist as well.
Yeah, they did come and surveil the house a little, and tell us a few things that could help with this condition.
Okay, that's great. And you mentioned that you live with your family. Is that why is thing okay at home?
Yeah, everything is great. I live with my wife, and she's the best person that I know.
That's great. I'm really happy to hear that, Tom. So let me just examine you very quick, and we'll start discussing about the medication. I would like to examine your vitals, and I also examine do a neurological examination. I also examine your chest, heart, and lung as well. I will also examine the tones and the nerves around your body, especially in the limbs. Would that be okay?
Okay, sure.
Fantastic. I'm really happy, Tom, that vitals like the pressure and the breathing rate and the oxygen level is quite normal and there is no high temperature. And there is what I appreciated with my general physical examination, there is only mild muscle weakness, as you mentioned early on. Other than that, everything seems normal, which is really good. And all the of our test, it seems quite normal, which is I'm happy with that.
Mm-hmm.
So far, Tom, you mentioned about Riluzole. Let me discuss about it.
2 minutes remaining.
Riluzole is a medication that works on the nerve and the nerves that usually damaged by the ALS, which is the medical condition that you're having.
Okay.
Unfortunately, Tom, it's not one of the cures of the ALS. However, it's usually prolonged it's improved the quality of life and increases the what we call the reduces the progression of the disease. So does that make any sense?
All right. So you're saying that I won't be cured if I take this medicine?
I can see this is might be upsetting and a bit worrying. However, unfortunately, ALS has no cure so far, and Riluzole is one of the medications that usually we have been discussed before with other colleagues. One of the medication that usually improve the quality of life, and not as a cure, and usually reduces the progression of the disease. Does that make any
All right.
sense?
Okay, so will I be able to take it?
What we're gonna do now, we're gonna have a talk. We're gonna have a talk with the senior neurologist. So we're gonna refer you there, and as we run some tests, it seems everything normal. So we can go ahead with that. Usually, he's gonna be initiating the medication. So, but probably he will do his own assessment as well before doing initiating medication because usually it requires a lot of monitoring, especially on the liver.
Okay.
In a lot of circumstances, it's likely that he will prescribe it to you as he see it might benefit you in the long term. Does that make any sense?
All right. Okay. And does it have, you mentioned it's got a lot of side effects. What are these side effects?
Move on to the next station.
Yeah.
All right, doctor. How did you think that went?
So there is the Riluzole criteria when he was a bit sad. I should have been at least lower my tone and speak things a bit slower, but I was a bit out of time. And he wanted to mention about side effects. So it has liver problems, unfortunately, some kidney issues, and along with drowsiness and stuff like that. So he needed a lot of things to be discussed as well. And I didn't
Yeah,
have much time to do follow-up and safety netting.
exactly. I mean, I think that's something that you should keep in mind because, like this the exam is assessed on three main domains, which is data gathering, management, and interpersonal skills. I mean, I would say your interpersonal skills are pretty good, but you're wasting a lot of time in saying things that you could eventually bring it in management. Right. So all the things about, if you have any problems, you can contact us whenever. That is something that you should bring it in management. In the beginning itself, you try to gather as much information as you can because at this point, you don't know what this case is. Right. So you're trying to understand this case. So be very focused with the data gathering. And if you want to show some interpersonal skills at that time, just say that I'm so sorry that I can understand that is a very difficult diagnosis, and this must be really hard for you. So let's talk a little bit more about it and find out how we can help. Right. So try to understand the situation better before you start giving all the comfort words, because the comfort words can come later. And you spent about 6 minutes in data gathering, right? So you do understand that you have 4 marks for data gathering and 4 marks for interpersonal skills and management, right? So you never really got to management. You're spending like just 2 minutes, and this is a counseling station. So counseling means you're supposed to talk more for management, technically, because they've come with an issue, they've come with a query. So what was the query? I've heard of Riluzole, but how did you hear about it? What do you know about this medication? That's something that you need to gather, like as soon as they come with something that is out of the ordinary, you need to understand, like, who did you hear it from? What do you know about this medication so far? Because then that would save time later on, because that could come in management. So these are what you need to do is you need to understand what this person's perceptions are at the moment and clear those perceptions. So only if you ask the question of how did you hear about it, what do you know about it, what do you know about ALS itself, and understanding the fact that he knows it's a progressive disease is good. Because at this point he didn't know that there was a cure, then he found that there was a cure on the internet, now he's come to ask you about it. So that is the situation now you have at hand. And this is the situation you need to manage. So what you need to do is you need to talk about ALS, like why it's a progressive disease. You need to talk about Riluzole, like how it helps in reducing the progression, yet not curing, right? And thirdly, on any misconception of if this is a cure, so you need to explain the fact that it's not a cure, because that's your task, right? So you needed to gather basically only that much information, and then bring it back in management, because you have a lot to talk in management, especially for a counseling sort of a case. Right, this is a medication counseling case where you're trying to explain everything around the medication. So the side effects, the monitoring, what the neurologist could do are very important over here. And quite frankly, you knew this case. You know how to, what is going to happen. I mean, you know what all you have to talk about. Just that you didn't have the time, because you ended up asking me about my, my smoking, my alcohol habits. Like, it doesn't
So
really matter.
yeah,
Like, at this
unfortunately, I usually found out the words in the middle. Talk to him, assess, and address the concerns he have. So the problem with the word assess, it made me think that I should do a full assessment.
All right. Yeah. I mean, yeah, definitely. That's something that can throw you off maybe. But I try to bring you back on the fact that I want to keep talking about this medication. Like this is exactly why I started, searching, and then I found reviews all. So this is the kind of hint I'm trying to give you to come back to management, get to management fast. Because if you see, the simulators will also try giving you these kind of hints. Like as soon as I say, no, I don't have any problems, I don't have any issues, then that's you don't have to spend much time there. Maybe ask one or two questions, like, are you having any swallowing problems? Are you having any walking problems? If I say no, then move on. Like, you don't need to explore more about the disease, because he already knows he has the disease. He goes to a follow-up with the neurologist as well.
Yeah,
Right?
and the physiotherapy, occupational therapy also does not need to come in the data gathering. You can just use that in your management instead of asking, because you should try to understand how much more you need to explain in your management, and try to cut down your data gathering, because you can always, whatever you have to say here, instead of smoking alcohol, asking here, you can always mention that again in your management day also. Right. So whenever you think that there can be things that can be moved into management, try to push them there.
Because a counseling case, you basically have to spend time in management. So you know that you have to talk a lot there. So you can't waste time in data gathering. All right, let's hand it over to the examiner. He'll explain you how you
So,
mark it.
and in the special note, always keep an eye, pay attention to the special note. They will only give that if it's important. Most of the time it will just say none. Right. So whenever there is a special note, that means they want you to focus on that. So whenever you see a special note, try to tailor your entire data gathering and management towards dealing with that alone. All right. So here basically, let's just go through your points one by one. So data gathering, you covered most of the things, but the most important thing to cover here would be how did they hear about Riluzole, and why it is important is, suppose if it has been prescribed by by their neurologist itself when they went to speak to them, that would be a different kind of management when you going to mention it, right? Otherwise, if they just hear it about it in the news or something like that, then you'll know that there is more misconceptions you'll have to clarify, right?
Yes.
Other than that, your interpersonal skills are also really good. The way you're asking the questions are also really good. But try to minimize your data gathering as much as possible. And did you realize that you spent a lot of time? Were you looking at the timer when you're doing the data gathering?
I wasn't looking at the timer. My camera is up. I'm using the phone. So when I was looking to the camera, it seems like I was looking somewhere else.
That's all right. Yeah, but try to whenever you're practicing, try to look at the timer, because that's the only way you'll develop an internal clock. Because otherwise you wouldn't know how much time you're actually spending, right? So always whenever you're practicing, try to keep your timer in front of you for 2 sessions, and then without the timer for 2 sessions, and try to guess how much time has passed while you're practicing. That way, make sure you stop your data gathering at 4 minutes, no matter what. Even if you know that you haven't asked a lot of important questions, it's all right. You can move on to management, because you've already done so whatever marks you're going to get for data gathering is done. Now you have to somehow get the 4 marks that you would get for management, because if you spend more time there, you probably get 1 more extra mark, but you'll lose 4 marks in your management, because the examiners are brutal about management. They'll just give you 0 directly. So because their entire thing is time management, how well do you manage your time? So if you don't give enough time to your management, you're losing marks in your management and your time management. All right, so that's going to you're going to take a hit on that. So try to move on to management as soon as possible. So here, your management was good, but you didn't have enough time to cover a lot of things. So explaining the diagnosis of ALS and the role of Riluzole in its management. So you could have started by explaining what ALS is, because the patient didn't really know much. They only knew that it's going to get worse. And so if you could have started that and then mentioned what Riluzole is and what it does. But that's all right. It's not that important since you didn't have enough time. But side effects. So whenever there's a medication, it's very important to talk about side effects, because that's the main thing in a medication counseling. So what are going to be what are the side effects they might expect from it? And you spoke about the referral to the neurologist and the pre-treatment investigations and the ongoing monitoring about the liver. That's really good. That shows that you have enough knowledge, right? That's very important as well. So even if you don't have enough time to cover everything, try to mention it in a single sentence. All right. So the best way to do that is to summarize your management. So once you explain what your diagnosis is, then you summarize your management and you tell what are the things that you're going to talk about within maybe less than a minute of time. If you can summarize your management and then ask the patient, what would you like to talk about? Right. That's a very good way to get what the patient's main important issue is, right? So the patient will definitely tell you again that they want to talk about Riluzole. Then you'll know that, okay, I need to talk about this now. So one thing is you clarified the misconception that it's not a cure, and other thing is that you need to tell him how it's going to be started and what are the side effects you can expect from it. All right, because he's relatively doing well right now. You don't know whether they would be okay with the side effects that can come compared to the risk versus benefit. Anytime you give a medication, think about the risk versus benefits. All right, because you ultimately have to give them that option. You need to tell them what are the risks, what are the benefits, and then let them make the decision. All right.
Yeah.
Then, so supportive care referrals. So you mentioned that in your data gathering. That's good. But yeah, it would be easier if you can just mention that in your management, right? And emotional, psychological support, counseling, support groups. Most important than all these would be your safety netting. right? Safety netting and leaflets. So what we tell everyone, at 2 minutes bell, there should be 3 things at the back of your head, right? Back of your mind. So 3 things that you have to cover in your management would be safety netting, leaflets and pamphlets, and follow up, right? So safety netting is very important because once the patient uh, leaves your consultation room, you need to make sure that they're not going to die, right? So that's the best way to prevent that is by giving safety netting. Just tell them the warning signs they need to look out for. All right, and leaflets and pamphlets are, it's a very easy point that you can get in your management by just mentioning that I'll give you some more resources. Just say leaflets and pamphlets. It's fine. You won't sound scripted or anything because that's what NHS calls it as well. So say that I'll give you some leaflets and pamphlets to make so that you can learn more about this, right? ALS and Riluzole. Right? So and follow up. Always talk about a follow up appointment. Even if you are referring them to a neurologist, you would have to see them again because it's your patient. They came to you first, right? You need to unless you set up an appointment with them, they won't be able to come back to you again because they don't have the power. They can't really set up, they can't call up the GP and set up an appointment that easily, right? They need to have if they have a pre approved appointment, it's much easier for them to follow up with you,
Yeah.
right?
So yeah, and then we have interpersonal skills, and I think your interpersonal skills again were pretty good. You were signposting properly, and you were being very empathetic, and you were using very common language. So that was good. So we'll just take you through this case. So what we have done for this for all the cases apart from the AI simulator is we have two sections to our platform. So one is the AI simulator and the other one is to review the case. So now in this case overview, actually talk about what you need to do in this case and how you need to approach it. So this scenario summary is basically what you need to gather from the question itself. So you know this is a 57-year-old man named Tom Riddle, which you have to confirm by asking him his identifiers. He has this ALS condition, and the duration definitely you need to ask because you need to understand, when he was diagnosed, at which stage is he in, right? And a couple of things that you could have asked was, is he in regular follow-up? Which he would have said yes, he is on a regular follow-up with the neurologist every 3 months, and he's seeking information about this new medication called Riluzole, right? And so how do you go about asking these questions? First, confirm the age and the identifier's name and age, and then explore his current symptoms, which you actually did, because every time a person comes with you with a condition, you need to understand at what phase of the condition they are and how much of the condition are they suffering from. So you, by asking him like what the current condition, if he has any symptoms, was a good approach. And also expanding on that, you asked him, do you have any vision problems or any swallowing problems, which is again good, because that you would know that is it progressing or not, is it the same stage. So so you understood that particular aspect about the disease. After which you need to have some that is, yeah. And then you need to ask him about any medication history. Now you need to jump into the fact about if he is taking any medications. So he's told you that he wants this medication and he has this condition. Currently, this is his symptom. So you understood the condition itself. So now you need to understand, is there any other thing, if you do give this medication, will it be, will it have any interactions with them? With this, if you were to say, you are a good candidate for Riluzole, like, does he have anything that can interact with this medication? So ask the medication history, ask any comorbidities that he might be having, right? And so basically, and alcohol history and smoking history. Alcohol history would be important because, as you know, Riluzole has an effect on the liver. So to understand if he has a healthy liver, that is also an important question. But I would say that is enough at this point, for data gathering. Because what you need to actually base your data gathering is about prescribing this medication. Now you have to move on to management, where you have to talk about ALS itself, like why is ALS a progressive condition and how does Riluzole help in this case, right? So basically what it does is, there is a neurotransmitter called glutamate, which is excessive in this condition. And this medication Riluzole actually reduces this neurotransmitter, and this neurotransmitter usually excites the nerves more than it should. And that's exactly what causes its damage. So now by reducing this neurotransmitter with the help of this medication, we would be reducing the nerve damage. And just in simple words. So by just saying that, this is how it acts, but since it cannot stop it entirely, it cannot reduce the progression. I mean, it will just be reducing the progression. It won't act as a cure. So by actually explaining him what it does, we can actually tell him that this is something that helps the condition, but is not a cure. You will continue having this condition, just that it would progress in a much slower way than it usually would have without taking this medication, right? And along with that, the natural questions that follow is, if I do take this medication, what will happen to me? Is there any side effects? And that's when you can talk about the side effects. That's why the findings were also important, because that's actually why we gave the findings kind of tailored to the findings that you need to have. So you could have some amount of neutropenia, you could have liver derangement, kidney derangement, and also you can have some interstitial pulmonary fibrosis or disease. So that's exactly why they do these tests. CBC, LFT, KFT, and chest X-ray is done before starting the medication. And every 3 months, if you continue having these, tests done to see if you end up having these side effects, and then eventually it becomes 1 year. All right, but that is something that the neurologist can explain better. But this is something, if you have further information, you give it, and if you have time, then only say. So just say that there are a couple of tests that need to be done before starting the medication, and when you're on this medication, they will be regularly monitoring you to see if you have any side effects that could happen with when a person is on this medication. Right, that's just simple words. So what you're supposed to do is you're supposed to refer them to the neurologist, and the neurologist, what he would do, you have to explain it to them. You're not giving medication, so you're actually counseling them on what is going to happen, right? So keep that in mind. So basically what you would be talking about is the pre-tests, explain what Riluzole does, the examination and the monitoring that follows, any side effects that you would be facing if you are on this medication, right? And the neurologist refer the person who does refer you this, prescribe you this medication. So you'll actually have to say that I will be referring you to the neurologist, who would be, after assessing you, would be able to prescribe you this medication, right? And then finally, some supportive care on, continue with your physiotherapy, because you understood that he undergoes physiotherapy. So say that that is something that actually helps, because this is a condition where you actually have to give supportive treatment, right? So continue with this physiotherapy, and if you have any extra drooling or any secretion, there are some medication that we can give for that. And if if you do feel, it is coming to that, please come back to us so that we can address it as soon as possible, right? Or any other severe weakness or any dark urine that you actually find, then please come back to us. So that will be a safety netting, follow up, and leaflets and pamphlets. So this way, if you see, in this case, most of your time should have actually been spent in management, because that's where the entire case was, basically. So that was a very good attempt. I understand that this could be a little confusing, especially when you don't know, like, where you're supposed to focus, because most of the time we do spend time in data gathering itself, because there is always so much to ask. There is always, because we have so much knowledge, we know that there is so many aspects to a disease, a medication. So we do tend to get carried away. And one way to actually help yourself to be on topic is by asking ICE. So ideas, what is your idea about this medication? What are your concerns? What are your expectations out of this consultation? They are like very important questions, because that will keep you literally on topic. It will actually tell you what the case is, so that you can actually address those things. These are the things that you have to talk about in management. So make sure you try doing ICE for every scenario. I mean, somehow or the other, you can paraphrase it and bring it into the conversation. So try using that. That's a very a useful tool that you can use. So we also have this in-time guide on our platform, where if you turn on the timer,
Begin.
you can actually see what what you should be.
Enter the room.
30 seconds. So we have divided it into 30 seconds chunk, where you can see to complete this particular scenario, what to be saying at every 30 seconds. So this is something that runs with the timer. So now you see this 8 minutes to 7.5 minutes has been highlighted. Now, as you surpass 7.5 minutes, then you can see that it moves with the timer. So as you're doing the consultation, if you have this guide in front of you, you could actually understand, how to structure yourself, how to, go with the timer, develop an internal clock. And that is something that can actually help you with your consultations. And do practice with the AI, where you can actually get evaluated and you can see which all points you're missing out. So every day that you practice, it gets logged by the date and the time that you practice. So you can actually see the progression of what you have missed in a certain case, and what you could have used. Yeah. All right, Dr. Ibrahim, do you have any questions, any doubts, anything that you'd like to ask us?
No, it was a really good feedback. I really appreciate it. It was really helpful in many ways. And honestly, I struggle a lot in counseling. I know that, because I was always try to cover many areas, because sometimes there are always hidden things in the history taken, or hidden things in the management. I've never been able to get them. And I know if I miss something they want me to talk about, I will follow the station. I'm a bit actually, that make me feel very cautious about everything. But still, I would lose management. So I know this is gonna happen, but it's gonna need a lot of change.
I mean,
best way is to actually somehow push yourself to move on to management. How much ever, even if you feel like you haven't covered everything in your data gathering, move on to management. It's all right. Even if because you will end up scoring well in your management if you try to cover the important aspects, which is safety netting, follow up, and leaflets and pamphlets. Right? Even if the diagnosis is wrong, even if the management is wrong, they just want to see you.
If you're a safe doctor.
Yeah, because not everyone can diagnose everything correctly at all times. They want to see you what you would do at in a time like that, right? That's what you need to show them.
Yeah, it's 1 mark and 52 marks minimum. That's the end of the station. So yeah.
I would say definitely keep practicing, and that's something that really helps. So keep at it, and I think you'll get a hang of it. You try doing different types of cases every day, and when you actually understand that there are different types of cases, there are different kind of approach where you need to focus on, I think things will get a little more easier. But one thing I would tell you is ask the most obvious questions. Like as soon as I ask you, like, doctor, I want to note or something. So the first question would be, could you tell me why? Like, doctor, I want Riluzole. Like, all right, can you tell me, where you've heard this medication, what you know about it? Try to understand where they are coming from, so that you can actually understand the case, because most of the times the case could be there is a misconception, maybe there is some kind of a idea that isn't actually aligned with the medical practice, right?
Yeah. Yeah.
And so that is something, try to keep in mind. Just ask the most obvious question, like why? Why do you want that?
Yes, I will do my best with that. Thank you very much.
Right.
All
Feel
right.
free to reach out to us in WhatsApp if you have any further questions. Right.
All
the
right,
best.
everybody. Thank you for joining us today. All the best, Dr. Ibrahim.
All the best, everyone. Bye.
Bye-bye.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.